ethical frontier of AI medicine. In my view, again, I said this at the beginning, I think that we're getting into uncharted territory. It's high risk, high reward. And I think that everybody should be part of this. It's not, in my mind, not really a revolution, but should be an evolution, a very well planned, thought out, methodical evolution. Because some of this stuff, we don't know exactly how it's going to go. And we have to be very, very mindful about how we implement these things and measure them and make sure that they're having the intended impact on people and health systems. But one of the other things I want to bring up that I hope we'll talk about a little bit is consent, about patients' consent. A lot of these, consent is a huge issue, and we're sort of assuming a little bit that people will consent to having AI as part of their health care. And so I just want to bring that up.
What's interesting is we've gotten more involved with value-based propositions and thinking about how we can help a patient population. I worry about, will I avoid a patient population? And we talk about the ethics in doing no harm.
Accidentally overlook.
Yes, right. Or targeting a patient population I'm only going to be successful in. We do really well with diabetics, hypertensives, or whatever our program is that somebody's created, and we're avoiding other patient populations. So I just want to be conscious of the fact that, to me, it's important to kind of stay true to, you want to help everybody. We really want to make sure care is designed and derived to really help everyone, and not kind of, to your point earlier, a subset of different populations not going to have the access and engagement that they need.
The ethical frontier of AI is significant. Many of the things we talked about, whether it be, you're talking about, cherry picking patients for a health plan by, really understanding where a select group of individuals are going to be present or how you attract them. And we talked about that in a really interesting fashion. We talked about how it could benefit clinical trials. You could identify a particular population with remarkable resolution. I run a health plan. Be good if I got a whole bunch of really healthy people. Now I have the capability of identifying, in a very similar manner, using the same tools, individuals that are likely to produce a lower medical loss ratio. And how that is governed will be difficult, because we know in the society we live in that the dollar revenue will force people to pursue paths that they shouldn't. And I don't think it's government oversight, because the government just simply moves too slow. I've been really a believer that the FDA process in the United States, it adds probably 5 years to a drug medication relative to Europe. I'm like, I don't know, do we really need that extra 5 years of paperwork and expense? So I don't have an answer there to say is how does the society, as well as the companies that create these products, how do they manage them effectively? What I will say, and I was involved in a very interesting presentation in Washington by an individual that worked only in sort of the area of, you'd really call it manipulation of society by extremist groups. And they would come back and they'd identify websites or blogs or things that were really incorrect. And boy, the social media companies went, oh yeah, okay, thank you. And not much happened. Right. So the self-regulation by social media has been poor. So for us to expect that the self-regulation by artificial intelligence will be better, I think that'd be a fallacy. And how that's solved, I don't have a good answer.
Should there be some type of oversight?
Probably.
Usually when there's not, things can go.
Well, let's ask the question, should there be additional oversight on social media? There isn't much.
Yeah, well, the freedom of speech versus facts. I think that's where the gray area is, and I think that we have to figure out a way to let the true facts, based on the studies and all the articles that come out, to help really guide really cite the information that's out there so we can make the best decision.
And how do we make sure we stay laser focused on people's dignity and fairness? You know, it's easy with the incentives as they are. There's a lot of monetary incentives for health systems and health plans that people without oversight, there could be. It's not hard to imagine people using the information for things that aren't specifically in patients' best interest.
Yeah.
I do think, you mentioned earlier the training of artificial intelligence models. That is a more solvable issue, which is to say, if the information used is curated, you think about UpToDate or other tools that have highly curated information upon which they build opinions, experts involved, you train an AI model on that information, it should, in general, give a very good result, one that is valid and not influenced at a disproportionate level by false information. But when you think about, frontier models that just gobble the internet, I mean, your ability to influence those will become omnipresent as you move forward. We've seen that in elections and other opinions.